Clobetasol propionate is a very strong topical steroid used to treat severe skin inflammation, redness, itching, rashes, and blistering. It is available in multiple forms, including cream, foam, gel, spray, lotion, and shampoo, making it useful for both body and scalp conditions. One of its most common uses is the treatment of plaque psoriasis, a chronic inflammatory skin disease that causes red or purple patches covered with thick, silvery white scales. These plaques are often itchy, painful, and can crack or bleed, commonly appearing on the elbows, knees, scalp, back, and sometimes the nails. Clobetasol works by powerfully reducing inflammation and immune activity in the skin, which quickly relieves swelling, redness, and itching. However, because it is extremely potent, it must be used carefully and for short periods only. The cream or foam is usually applied as a thin layer twice daily for up to 2 weeks, and total use should never exceed 50 grams per week. Using more than recommended or using it for too long can cause the medication to absorb into the body and suppress the hypothalamic pituitary adrenal (HPA) axis, leading to hormonal imbalance. Clobetasol should not be used on the face, groin, armpits, or near the eyes, and it should not be applied to skin with active viral or fungal infections unless combined with proper antimicrobial treatment. Covering treated areas with bandages can increase absorption and raise the risk of systemic side effects. In children, clobetasol is especially risky because their skin absorbs more medication, which can affect growth and hormone levels, so its use is generally not recommended under 12 years of age. Common side effects include skin thinning, lightening of skin color, burning, irritation, and easy bruising, while long-term misuse can lead to Cushing syndrome, high blood sugar, adrenal suppression, glaucoma, or cataracts if exposed to the eyes. The solution is simple. Use the smallest amount needed, for the shortest time possible, exactly as prescribed, and stop the medication if severe irritation or skin thinning occurs. When used correctly, clobetasol can be highly effective, but when misused, it can cause serious harm.